Health Live at Seniors today. We are having some technical issues, but we now have Dr. Gore, who has going to be here. You're on mute. You're on mute.
Okay. There. Hi.
You're on mute, doctor. You're on mute.
Yeah. Now can you hear me?
Yes, I can hear you.
Right. Fantastic. Thank you for this opportunity. It's a nice.
Yeah. So, doctor, we'll do all the introduction and all that. We were just waiting for you to come.
Just let me try and share my screen once.
Yeah.
See if things are going well.
Yes, they're going well.
You're able to see my screen?
Yeah. But I'll have to, yes, absolutely fantastic. But doctor, I'll have to request you to go off the screen share for a minute. We do your introduction.
But just see if the videos are playing. That's what I just want.
शौच की जगह की हर तकलीफ को सभी लोग पाइल्स या
Are you able to listen to the audio also?
Yes, we can hear the audio as well.
बसिर कहते हैं.
Okay, fantastic. Fantastic.
Great.
Oh, I think everything is done. And yeah.
Can you just stop the screen share?
Stop. Okay, done.
Right.
I'll just.
Hello and welcome to Health Live at Seniors today. We are delighted to have here with us Dr. Pravin Gore. Dr. Gore is a senior proctologist, which is a specialist in colorectal surgery. And he is going to be speaking with us today about piles and colon care for seniors. A little about Dr. Gore. Dr. Gore has done his MBBS and DNB in general surgery. He did his fellowship in colorectal surgery from Madurai and an advanced colorectal surgery fellowship from Birmingham in the UK and a laparoscopic colorectal surgery training in Rome University. He has been pursuing pure-focused colorectal surgery practice for over 2 decades in Mumbai. He is attached to elite hospitals like the Wokat hospitals and other corporate hospitals. Plus, he's an honorary member of the Department of Proctology, which is one of the only departments of proctology in India at the GT Hospital, which is, as we know, a branch of the well-known JJ Hospital. He received the prestigious Dr. Abdul Kalam Azad for excellence in colorectal surgery from former Chief Minister of Telangana State. Dr. Gore is arguably the only surgeon in India to offer botulinum toxin swinker pharmacies, that is Botox treatment for anal fissure surgery. Plus, he pioneered the technique of Bush, that is short for bloodless ultrascopic scalpel hemidectomy, which I will request Dr. Gore later for the pronunciation. He has been a faculty at the national and international levels and delivered several lectures and has many publications and textbook chapters in his name. He is one among the only 3 School of Proctology specialists in the city of Mumbai and one among the 46 surgeons in India who focus on colorectal surgery. We are delighted to have Dr. Pravin Gore here. Welcome to Health Live at Seniors today, Dr. Gore. Can you put on your camera, Dr. Gore? We have multiple technical issues today. Yeah. Welcome to Health Live, Dr. Gore. How have you been? I'm sorry, I can't get your audio.
Okay. It is going on mute again and again because people are here to listen to your fantastic vocabulary and voice.
But I can't get some pronunciation right, so which I'll get to later. Welcome once again, Dr. Gore. This is the first time we're having a session on piles and colorectal surgery. We've had some discussion on colorectal surgery in the past, very early on in our health webinar series, but it is good to have a discussion on this, and especially as to how it concerns seniors. So I know you have a presentation ready, so over to that, and then we can get on to questions. Those of you who have questions, please put them in the Q&A tab. In case you do not want to reveal your name, you can just send your question anonymously. But do mention your age and your gender so that Dr. Gore could give a considered reply. Yeah, as once again, I do understand that people may not want to give their names out for something like piles, etc. But that's all right. We will respect that. And in any case, I will not give out any name of anybody in today's session. Yeah. So over to you, Dr. Gore, for your session, for your presentation.
Yeah. Hi. Namaskar. Good evening. Thank you so much for having me at this session. I really see that you are doing a commendable job for all these seniors. And this is a subset of our population who have gained enough amount of experience and they are in their twilight phases of their life. You may say silver lining of their life. But they do face a lot of issues. They do face a lot of issues, especially in terms of their digestive system. And thank you so much for taking this topic because, as you rightly mentioned, many people would not want to mention their names actually in case they have any questions or problem. So yes, I would start my lecture by saying the anorectal problem are the problems where patients just suffer behind the closed doors of their own toilet. And they really do not want anybody else to know about it. People talk about everything, all the issues in this world, HIV, breast cancers, LGBT, and God knows what else. But at the same time, when it comes to all these bottom problems, the husband doesn't tell the wife doesn't tell the husband, and forget about anybody else. So yes, they silently keep on suffering, I may say so, behind their closed doors of their own toilet. And where to go, what to do, that is something which is a very, very confusing, very, very challenging issue out of embarrassment. So today, let us focus. Mr. Maheshwari, how much time do I have? So I can
Well,
just...
you have around 25 minutes for your presentation, and then we'll have the Q&A.
Okay, good. So I'll try and wrap up all the key points in that time frame. Right. So let us start with piles. Any bottom problem, everybody will call it as piles. Like if a person has a fever, not all fevers are malaria. If a person coughs, doesn't mean that he has corona only or COVID. But if the patient has any bottom problem, they will call everything as piles. So it is like a title, a misnomer. The actual piles or hemorrhoids are something different. And there are nearly 27 diseases where the symptoms are similar to piles. Mr. Maheshwari, should I continue only in English or Hindi, English mix and all this?
I would prefer in English because we have a lot of people from South India as well. So
Okay.
English is better. But you can pepper it with a bit of Hindi. That's no problem.
Okay. That's nice. That's so nice. So let us go forward. Now let us take two cases which will usually summarize the whole subset of these patients who have this bottom problem. I get this 64-year-old male who is on diabetes and blood pressure medicine. He had just recently had a bypass surgery done for his heart attack, and now he is on blood thinners. And his complaint is every time he goes to pass motions, he keeps on dripping blood. So blood coming out from that part of the body which is not visible is a very frightening thing for most of the people, not only senior citizen, but anybody and everybody. If you see a blood coming out from an area of the body which is visible, you can do something about it. But from there, the patient is aghast. The patient is really frightened. What to do, he does not know. And what happens is they keep on taking all these home remedies, laxatives for a very, 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 very long time without even realizing that they eventually potentiate or precipitate this existing problem. So what is piles? If I may just say, I'll just play this thing in.
नॉन की जगह की हर तकलीफ को सभी लोग piles या बवासीर कहते हैं. Any problem around the anus is called as piles in a common man's language. तो ये जो हमारी लैट्रिन की जगह है, इनकी दीवार में ये खून की नसें होती है. जब भी लैट्रिन इनको घिस के जाती है, तो अंदर से वो छीलते हुए जख्म पैदा करते हुए खून पैदा करती है. और लगातार जोर पड़ने से ये खून की नसें ढीली पड़ के नीचे नीचे सरकना शुरू करती है। इसे पाइल्स कहते हैं, जो दिखने में ऐसे होते हैं। ये अंदर वाली और बाहर वाली पाइल्स।
Right. So if I can just mute it and play it back again. A very small video, but anybody and everybody will call all bottom problems as piles only. So what happens is there are these normal blood vessels which supply blood to this area. So these are the normal blood vessels and they're attached in the wall. Now, because of hard stools and constipation and forcing, they will lose there will be a tear and that causes bleeding. And they will start losing or breaking their supports and everything starts sliding down. Now, this is called as hemorrhoids or piles, and they would look like this, the internal one and the external hemorrhoids. Right. And there are various modalities of treatment for hemorrhoids, but usually what happens is a patient does not want to go to a doctor because everybody says if you go to a doctor, he will always offer a surgery. That is not the case. If the patients come in the earlier stage, the early first and second degree hemorrhoid, their diet and lifestyle changes can definitely take care of their hemorrhoidal issue. And there are good amount of medicines and local applications which really can solve their problem for the time being. But if they continue to have the precipitating factors like constipation and all, then it will definitely go on getting progressive. Now, when it goes to grade 3 and grade 4, when the bulge is popping out, if you have to push it back inside or it remains outside, that is the time when the piles or the blood vessels, they say, enough, I have stayed enough in this person's body, I just want to come out. So the piles are telling us that they need to come out. And this is where colorectal surgery or proctology comes into the picture. Here we offer what is called as the bloodless ultrasonic scalpel. It is an ultrasonic scalpel, and during surgery there is not even a single drop of bleeding because of the technology. Plus, there are lasers available nowadays, and lasers do a phenomenal job, especially in the early second and third degree hemorrhoids. And if there is a large chunk involvement, circumferential involvement, then we use a stapler. So the message is not all piles, not everything is piles. Not all piles will require surgery. If surgery is required, you don't need to be worried. There are multiple modalities available. But just because मेरे पास ब्रह्मास्त्र है तो मैं सब जगह पे ब्रह्मास्त्र नहीं use करूंगा. Just because I have technology, I will not be using technology. A precise, proper technique has to be selected and tailored according to an individual patient. And this is where the role of a colorectal surgeon or a proctologist comes into the picture. If you do not have a colorectal surgeon or a proctologist in your area, a general surgeon or a GI surgeon is equally competent enough to do the job. But I would suggest and request, please avoid all the non-qualified people because you will be spoiling the natural anatomy for them. Right. So as per our guru says, knowledge is everything, but lack of knowledge is equal to fear or problems. तो सारी समस्याओं की जड़ अज्ञान होती है. So this is the colon, the large intestine, rectum, and the anus. I deal with only these problems. So what do we need to have is we need to have a balanced diet. And fortunately, we are so great to be in India where our dietary patterns do provide us a balanced diet, be it a South Indian, be it a North Indian, an East Indian, a West Indian, a Central Indian, or wherever you stay. Though the diet format is different, but we do have all the balanced diet. But it is not only the diet, it is not only the sattvic ahar, it is also the sattvic vihar. Vihar in the sense Jivan Shaili in the sense the way of life, the rhythm of life. So that is also very, very important. You really need to stay a little calm. You really need to focus on ourselves. And I always keep on saying, God is great. If you don't believe in God, then nature is great. Nobody can go against nature. And let us balance our life in such a way that your sleeping habits, your food habits and timings, be conscious about your body movements, be conscious about all the activities and the work that you do, and especially what is going on in your brain. Because even when we are a little tensed up also, you get a ball in your stomach and that triggers all these IBS symptoms and all. So meditation or staying calm or prayer or whatever means to calm down your mind plays a very, 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 very important role. And people usually neglect that thing. And yes, junk food is easily available and it is very addictive, habit forming. And nowadays with all these food delivery apps and all, people don't even want to go out of their house to have some food. They will just order anything and everything and just stay in the house. So it potentiates the habit of junk food eating, at the same time sedentary lifestyle. If you don't move, the body will also not move. And finally, it will end up into what is called as constipation. Constipation has actually uh, devastated many people's life, and it is suggested that almost 14 million days per year are gone just because patients take leave because of constipation. Even in India, beyond the age of 60, one third will have constipation, and more than 50% are already taking laxatives. Isn't it alarming? I think we need to really give it a thought. Before that, let us see what is normal passage of lymph. So every time we eat some food, it gets dissolved in the digestive acids and the juices. Nearly 12 to 14 liters of different various chemicals are secreted, and the food gets dissolved or digested inside, and the residue comes in the large intestine. Now, this is the large intestine, which ultimately ends in the rectum. Now, these intestines are continuously moving. So it is a normal rhythm. Like, people fart even in their sleeps, Why? Because of this. But once or twice in a day, there is a gush of movement, which is called as peristalsis, which pushes all the contents forward. Now, what happens is, if this gush of movement is not happening, then the patient will have constipation. Now, especially for seniors, you cannot compare your body and body movement with the 20 or 30-year-old guy. They will be much faster, right? You will be relatively slower. But we always want to have motions every day. Now, try and remember this thing. As age advances, the movement of our intestines also slow down a little bit. So even if a person does not have motions every 24 hours, if they have it every 36 hours or in 48 hours also, that is considered as normal, as long as it is not a very rocky hard stool, and as long as it doesn't come for 2-3 days at a stretch. Till that time, there is no need to worry. The whole life we have been stressed and made a habit for ourselves that every day you have to go to the motion, get yourself fresh, and then the full day will be fresh. But as age advances, it would be prudent to accept, yes, the movement of the intestines will slow down, and you may not have a motion every day. So don't fret about it. Sorry. And then what happens is, once the contents reach the rectum, now again, I tell you, God is great. Why? Because you see this mechanism, the anal muscles are airtight, watertight. अपनी मर्जी के बिना हवा भी नहीं खुलता है, पानी भी नहीं निकलता है, right? So, but at the time of motion, they have to open up, right? So the rectum has to push and the anus has to open up. So there is a smooth coordination, a very delicate balance in this thing. But before that, once the rectum gets filled beyond a certain capacity, it sends a signal to the brain. Now I am full. Now I have to go out. Now, if these nerves are not working properly, then also people land up into constipation. And again, God is great. What is called as sampling. See, we have the ability to differentiate between gas and stools, don't we? If it is gas, we can let it go in India. If it is stools, we need to hold on till we go and visit a toilet or a private place. But this ability, if it is lost, then also there is a lot of problem. So what happens is, when the rectum has to now push, the anus has to open. When the rectum is pushing, the anus is opening. And then it will allow all the stools to come out. And at the end of it, everything should get cleared and it should close back again. This is happening at a subconscious level. Are we even aware about it? No. So the second message over here is, be aware of the movements of the intestine. So whenever we go to the loo, whenever we have to go to the washroom, just try and figure out, am I having enough pressure to go? That is called as call of nature. No? So don't try to give a missed call. So just try, have I to answer the call of nature? Yes. Go inside, relax. As long as you relax, all the contents will come out. If you keep on forcing and closing the doors, all that matter will not go out. Then forcing or straining is detrimental. So instead, in case a patient is constipated, you need to relax and allow the stools to come out. And we need to find out the root cause, because what happens is, if anybody has a fever or a cough, as I told you, you'll find out whether it is malaria, typhoid, dengue, or it is COVID or bronchitis, and then you will take the treatment accordingly. But when it comes in terms of constipation, it is just a trial and error. They will try all sorts of medicine, laxative, home remedies, and all your well-wishers. They will also give you all this suggestion. Here, that brings me to one small joke. You know what is the definition of a well-wisher? A well-wisher is the person who will push you in the well. So be very careful when you are listening to a well-wisher. Right. So this leads us to the case number 2. I have this 71-year-old lady who was on thyroid medicines, and she needs to take 20 tablets of laxatives to have one good motion. Why? Because since the age of 22, 23, she is on laxative. Why? Because somebody told them these are non-side effect forming medications, natural medications, and you have to take it. There is no harm in taking it. It was not harmful at that age, but at this age, now the normal nerves, which give the sensation to the brain, I have to empty or I have to push, they have stopped working because the laxative was working so many years. So these normal nerves, they did not do their homework, and they said, "Bas, I don't want to attend any class anymore." And they have to do what is called as Ganesh Kriya. I just came across this term just recently. In other words, you really have to finger out and pull out the stool to such an extent that sometimes she uses the toilet jet as an enema for herself. And believe me, friends, there are patients who are having such severe form of constipation, and they are miserable, and they don't know where to go. Yes, they are frustrated, and they really actually give up hopes of living. If you have seen this movie Piku by Amitabh Bachchan and Deepika Padukone, it actually is based on a true life story of many of these constipated patients. If you haven't, you go and see the movie Piku. I will really urge you. I'm not advertising, but it will really give you a good perspective about all the things. So what is constipation? No urge to pass motion is a constipation. Incompleteness is constipation. A hard rocky stool is constipation. And you need to do some maneuvers to pull out or push out the stools. That is also called constipation. So depending on all these things, we need to figure out how to treat it. Now, as I told you, every day we have trained ourselves that we have to have a motion. If you have a good motion, we are happy. If you don't have a good motion, then you are sad. Very clear-cut formula of life. What are the contributory factors? Age, diet, sedentary lifestyle, water intake, all the vices, good and bad habits, and the different postures, whatever we say. So what are the causes of constipation? We need to find out where the cause is located. Is it in the intestine? Is it in the rectum? Or is it at the anus? So depending on that, we have to treat constipation. Plus, all these patients have what is called as an iceberg phenomenon. They have anxiety, depression, insomnia, and a lot of psychological issues. That also needs to be addressed. Not only a physical constipation has to be sorted out. Who will do all these things? Well, here we are colorectal surgeons who are doing this dirty job. Then many people have a very lax, loose body structure, a very pouting like anus, and they have a hard stool where the liquid stools keep on seeping outside from apart from the liquid stool, and they always have to wear diapers. They are not having loose motion. Actually, it's a hard motion, and soft stools are just trickling from the sides of this hard stool. These are called spurious diarrhea. But who will diagnose all these things? There has to be some person who will diagnose them. Who is the specialist? And how do we evaluate? We have a host amount of investigative methods like anorectal manometry, MRI during the act of defecation, colonoscopy, and colonic transit time. We come to know how long does it take for the food to travel through the intestine. And after this, we have a diagnostic evaluation flowchart, which is time tested and proven. And there are multiple modalities of treatment available. So friends, senior colleagues, if I may say so, it is a scientific approach. It is a proper medical approach rather than just going haywire and trying to grab some form of treatment for constipation and piles. Do you really want to play with your own health and body, especially at this age? I would urge not to. Go to a specialist, proper person who has put his decades of life in only treating these issues. What happens? If constipation is not treated, we get piles, fissures, fistulas, prolapse, and yes, even cancers of the colon can be aggravated just by constipation. The piles, as we already have explained, the blood vessels swell up and they start bleeding and popping out. Fissure is nothing but a crack or a tear in the anus, and that is giving rise to severe amount of pain, like burning, poking sensation, which lasts for a few minutes or sometimes a few hours actually, even after passing motion. And if there is a crack in the wall, all the bacteria, see 30% of our stools, 30% of the weight of our stools is bacteria. But we do not get infection out of that. We get infection only when the inner wall is breached. There is a tear. So the bacteria, instead of going out, they form a hiding space outside the wall, and there they grow and they form pus. And when they comes out, that is called as the fistula. What do people do? The senior most Dr. Google. They will just go on Google. And what will Dr. Google say? You have cancer. And what will the patient say? Oh my goodness. Do you really want to go through all these issues? The answer should be no. Now, if there is no urge to pass motion, we have methods to diagnose and treat. If there is incomplete evacuation, we have methods to diagnose and various methods of treatment. If it is a hard stool, apart from only laxatives, there are many other things which we can do. And if somebody needs some pulling, pushing, fingering, that also can be sorted out. Many huge number of treatment modalities. Psychological, yes, treatment is required. So the take-home message would be, have to have enough amount of fibers. But fortunately, as I told earlier, our Indian diet has enough amount of fibers. Fluids. How much fluids? At least 2.5 to 3 liters and beyond, because 2.5 liters is required to run our own body. Your kidneys, urine, your sweat, your vapors from your breath. So that amounts to almost 2.5 liters of loss per day. So you have to replace that. How will you replace it? Carry a water bottle with you. I do always. And even if you are not thirsty, have a couple of sips of water. No? देखते देखते दिन का 2.5-3 लीटर ऐसे ही पी जाओगे, मालूम ही नहीं पड़ेगा. At a subconscious level, you can have it. So build this habit. So this is the third take-home message. So have good amount of fluids. Soups are there, chas, dahi, lassi, and no, these are not recommended. Right? What to avoid? Maida, bakery product. Because what happens is, you have seen when the maida rotis are being made, so sticky, rubbery. If you can eat maida rotis and all when they are hot, it's well and good. थोड़ा सा ठंडा होने के बाद आप रोटी तोड़ने की कोशिश करो, नान कुलचा वगैरह, तो पेट के अंदर जाने के बाद भी तो वही होता है. When it goes in our intestine, that time also it happens the same thing. Try and avoid as much as you can. Don't answer the call of nature if nature does not call you. Unfortunately, it so happens that our Sulabh Shauchalayas in India are not up to the mark. And that's the reason, especially in females, when they have to commence a long journey, they would want to, clear off their bowels before commencing the journey, even if they do not have the urge. And this, over the time period, will precipitate into constipation and descending perineum syndrome. For hemorrhoids, as I told you, we have multiple options available: stapler, ultrasonic, lasers. For fissures without surgery, I do botulinum toxin sphincter spasmolysis. For fistula, we have lasers and video-assisted fistuloscopes, where I can just pass a telescope from here and just remove this whole fistula from inside. Laser is a new kid on the block. So finally, the take-home message is constipation is no longer just a symptom. Constipation really can precipitate all the other bottom problems. All the bottom problems are not piles, though everybody would want to label it as piles. There are 12 different varieties of piles, and there are 27 different varieties of diseases which have symptoms similar to piles. We need to really pinpoint to the correct diagnosis, and only then an accurate treatment can be given to a particular patient. So the treatment has to be tailored from patient to patient. It is not like a gross formula for everybody. It is not a Raman Ilaj for everybody. So that's the reason why in my consulting, I need at least 20 minutes or 25 minutes for one patient, because 10-15 minutes goes only listening towards the patient. What is the patient's problem? And unfortunately, not many busy doctors have that much time to spend for the patients, which is paradoxical, ironic, hypocritical. If the doctor doesn't have time for his patient, then what is the use of his time? But yes, listening to the patient gives us enough amount of diagnosis. And we select the investigations wisely. There are the therapies available. And just because I have a laser or a stapler, I would not do more harm. Only if the patient benefits, then yes. If it doesn't benefit, it's preferable to find out an alternative thing. Laxatives, dietary, and lifestyle augmentation is the key. The main thing is your food, water intake, your mindset, your daily rhythm of your body, your posture while passing motions. You need to be very relaxed. And I'm sure these bottom problems will not give you any problems at all. So thank you so much. I wish that every day you have a fresh morning or a good morning. And अंत भला तो सब भला बोलते हैं, but I would say शुरुआत भली तो दिन भला. Thank you very much. I would be happy to answer any questions if there are.
Thank you very much, Dr. Gore. Thank you very much for an excellent presentation. And I think most of the questions that people have been answered. So we have Mr. Bharat Mehta, who's age 66. He has asked a question about what is the reason for the piles problem in the human body, how to cure piles. You've already mentioned that. Mr. Sudhir Srivastav has asked, does all piles bleed? If it does not bleed, is there any need for surgery?
Yes.
So that's a question which we've also addressed. We have a question from Mr. Jagmohan Sani, who says piles operated once again requires operation after some time. He has another question. He says, is Triphala advisable to take at bedtime?
Well, let me start from the last question first. First and foremost, Triphala is an Ayurvedic proprietary, and I am an allopathic doctor. I have zero knowledge about that thing. So I cannot say for or against it. So please pardon me. I would not be in a right position. I'm not the right person to answer that question. Better ask one of your Ayurvedic consultants who practices Ayurveda. The second question by the same person is piles needs to be operated again and again. As I told you, there are many diseases where the symptoms are similar like piles. Now, if the doctor has really told the patient that, look, you have fissure and I am going to operate fissure, right? But if that explanation is not given, the patient will always think I have had piles, I have had a pile surgery, and later on I develop another piles. So whether that when we remove that piles, see, खून की नस जब फूल जाती है उसको piles कहते हैं. When the blood vessel swells out, that is called as piles. When we remove the blood vessel, ना रहेगा बांस न बजेगी बंसरी, no bamboo, no flute. खून की नस ही नहीं रहेगी तो फूलेगा क्या, piles क्या बनेगा? So once we remove the piles, then that patient will never ever have piles at that place. So there are so many blood vessels around in the anus. If your lifestyle Piles and constipation is a lifestyle disease. If your lifestyle is not good, then eventually you will keep on having all these issues again and again. That does not mean that in case there is a symptomatic piles, you don't go in for a surgery. If it is, you need to go in for a surgery. But believe me, when the patients bleed, they bleed torrentially. Torrentially. I don't want to frighten you or anybody else, but right from their home till the casualty department, they will be dropping and dripping bloods and all this. And by the time they come to the casualty, they will faint in their casualty or they faint in the toilet itself. So another take-home message for especially all the seniors is, when you go to the washroom, please don't lock the door inside. Please don't lock the door inside. You close the door, let somebody know that you are in the toilet. So please don't lock the door. If there is any mishap inside the toilet, nobody will come to know. And even if somebody comes to know, nobody will be in a position to help you immediately unless they have to break the door. So please don't lock the door.
That's, I guess, an important tip. Whether it's piles or anything else, I think it's important for all seniors to be careful and watchful of on this point. Doctor, we have a few more questions that have come in. One is from Mr. Jagmohan Sahni, which you already answered. Mr. Prashant Patil asked, what is the difference between external and internal hemorrhoids?
Well, there are two types of blood vessels, one which runs under the skin and one which runs inside the anus. So they are both called hemorrhoidal vessels, and whichever swells, that is called as hemorrhoid. So it is an external hemorrhoid when there is a ball-like swelling outside, and it is an internal hemorrhoid when the pinkish inner flesh starts sliding down. And there are internal, external, that is a combination of external and internal. Because all the precipitating factors will play not only on the internal or the external hemorrhoidal vessels. They will precipitate the whole area. And that's how you get this internal and external parts.
So, doctor, the word that I could not pronounce was ultrasonic scalpel.
Hemorrhoidectomy. Hemorrhoidectomy.
All right.
So hemorrhoid excision, you can say so. Removal of hemorrhoid. You had this question, no, if there is no bleeding, should still the patient undergo surgery?
That's right.
Yes. In the initial stages, the bleeding is not the only alarming symptom. When there is a ball-like structure which is coming and blocking the outlet, it is like the goti soda. If you know goti soda.
Yeah.
So a ball-like thing which is coming and blocking at the outlet, it will precipitate constipation. And patient will keep on forcing and pulling and pushing, and eventually piles में काम हो जाना चाहिए था तो rectal prolapse लेके आ जाते फिर हमारे पास.
Right. We have two more questions, doctor. One is a question from Sajni, who asks, what associated with the IBS, how does one deal with diarrhea?
IBS is a very notorious disease. Now, let me tell you one thing. What is IBS? IBS is no disease. It is called as irritable bowel syndrome. That means when the doctor has tried all sorts of methods, clinical as well as investigative method, and they have not come to a conclusion as to what is the cause of your problem, then they label it as syndrome, so irritable bowel syndrome. So there are loose motion predominant in irritable bowel syndrome and constipation predominant IBS patients. So if there is a loose motion predominant thing, then I think the comments, the bacteria, our intestine have bacteria. As I told you, 30% of our stool weight is bacteria. But there is a balance. There is a balance between a good bacteria and the bad bacteria. If you try to restore this balance in a proper way by taking good amount of probiotics by prescription from a medical gastroenterologist, then the detrimental effects of this severe loose motions can be controlled. But yes, once IBS patient, they are miserable. And the other part of the story is, if the patient is labeled IBS, stamped IBS, then wherever he goes and say that I have IBS, all the doctors, they look from a different perspective towards the patient, and the actual diagnosis really goes for a toss. It is very, very dangerous.
All right. Doctor, we have another question from somebody whose name I will not disclose, who's 68, A few years ago, he says he had gone for a treatment, a naturopathy treatment, which
I lost the connection.
he has a good and comfortable stool passing session. When I was in treatment, I finished my morning ritual fully satisfied. But in a few hours, I had round two, and it passed smoothly. Soon, a third time, and I was wondering where was so much coming from. I've been very careful with my food intake, but sometimes someone said it's cleansing. Just a couple of days back, I had my ritual around 7:30 a.m. and at about 9 a.m. once more. I had so much, so I truncated my walk and went home to do one more round of smooth clearance. I never felt it was an incomplete session. What can this be? Doctor, have we lost you? Uh, technology. We have lost Dr. Gore, but he's back. He's back from two different devices, which is very good. Yeah, can you unmute yourself? Yeah, can you hear us, Doctor?
Yes, I'll leave from the other device.
Yeah, so this is, as I mentioned, a 68-year-old who went in for naturopathy treatment. All of it was fine, but he did have to go a few times. Now, a couple of days back, he had his morning ritual at 7:30, and at about 9 a.m. once more, he had so much that he had to shorten his walk and went home to do one more round of smooth clearance. I never feel it was an incomplete session. What can this be? His question.
Well, one off episode or an event like this should not be of any big gross meaning. But if it is happening repeatedly, then yes, you really need to evaluate as to what is happening. Now, naturopathy, with all due respect, you have to reach, for example, you have to reach Delhi. You can reach from Kashmir, you can reach from Mumbai, you can reach from Kanyakumari, you can take a flight, you can take a train, you can take a car, you can go walking. So there are various modes to reach a particular thing. So in our body, if we want to achieve good health or well-being, then there are different modes, modalities to reach over there. Allopathy, Ayurveda, homeopathy, naturopathy, Unani, home remedies, yoga, tens and different ways and methods and all this. So I'm not against anything or anybody, but we should not unnecessarily finger around with the normal rhythm of the body. Unless and until it is really troubling you, why to unnecessarily go out and finger? Because it's a very delicate balance, all these digestive movements, of the movement of the intestine, the valves at the esophagogastric junction, at the gastrointestinal duodenal junction, at the anorectal junction, at the ileocecal junction. All these valves, they have a unidirectional movement, and no point in just triggering and fingering around with some means and methods. Especially from my allopathic perspective, I would say so.
Thank you, Doctor. Just a few more questions. I hope it's okay. We are at 5:45 now. Doctor, is it okay if my husband, 77-year-old, who passes motions with great difficulty every alternate day, is it okay if he takes Kremafin once or twice a day?
Again, as I told the intestinal movement also slow down. So at the age of 71, 74, even if the patient passes motions alternate days, it is considered as normal. See, blood pressure in a 30, 40-year-old individual is 120 by 80, which is normal. But a blood pressure in 60, 70-year individual is 130 by 100, 130 by 90. Because the blood vessels get a little stiffer. So their normal is different. A young person's normal is different. Likewise, for 74-year-old, alternate days motion is normal as long as he really doesn't have to fret and push for his motions. And Kremafin is a medicine. When do we take a medicine? When there is illness. Is it really an illness? You have to ask the same question to yourself. Is it an illness for you to take a medicine? If you feel yes, then go to a doctor and take a prescription-based medicine rather than doing a trial and error. See, that's what happens in our country. Just because some educated people know a few brands of medicines, they will just keep on popping those medicines time and again. Eventually, what is called as melanosis coli. Melanosis coli means irregular long-term misuse of laxatives will stop the colonic inertia, colonic movement, and it will lead to colonic and rectal inertia. Not many people
That's
are
a
aware.
that's a very bad state to be in.
Yeah.
Doctor, I'll just rush through a few questions. You mentioned initially that there are very few. When I was introducing you, I mentioned there are very few people who are specialists in colorectal surgery. We have a question from Mr. Jagmohan Sani. Says, can you suggest a hospital in Delhi where we can? The big hospitals there do have specialists.
Yes, I think Apollo and Medanta, they both have colorectal departments over there. You
And
just
can one consult you? Can one do a teleconsult in case they're not able to make it to Mumbai?
Oh yes, teleconsultation is quite possible, not an issue at all. I'll ask my colleagues at Wokarn Hospital to help you with the contact details and the online consultation timings. Definitely that can be done.
So, as always, you know that we carry the edited video, which is deducting all the times when we were off camera or there was a tech problem. So we will have a session. We'll have this edited video on seniorstoday.in, and also we have a registered medical practitioner who writes the takeaways from this session. So they will also be there. Okay, two more questions I have. One is they're both in colon. How to check if the colon is clean? If not clean, how can one keep it clean on an ongoing basis? That's question one. And there's another question which is from a 74-year-old. He's non-diabetic. BP is 130/80 with medicines. For the last 1 year, he is suffering from ulcerative colitis, only from rectum upwards up to 6 inches. He has consulted 2 senior doctors, taken steroids, no constipation. He had piles 25 years back and was operated. Doctor, is ulcerative colitis also under your discipline?
Yes.
So that's
Yes.
your answer, Miss Sir. I'm not going to give your name, and you can always consult Dr. Gore at the Wokat Hospitals in Mumbai, which is at near Bombay Central. And to the question about how to check if the colon is clean, and if not clean, how can one clean it on an ongoing basis?
See, at the end of passing motions, do you feel the sense that there is something incompleteness, there is something left over there? Then you know that it is not clean. Then you really have to go and consult a doctor, because it may be the rectal prolapse or a wall or a rectocele in females, which may be mimicking like you have not cleaned your motion. So just the sense of completeness of motion is enough for you to testify or just to qualify that your colon is clean. The whole colon is 100 centimeters. The whole of the large intestine is 100 centimeters. You really do not need to keep a track of that. Only the last 10 centimeters, the rectum and the anal junction, that has to be clean.
And one last question from an anonymous attendee. He's asked it a few times. Does fissure, can this be fully cured at a one-time surgery? And why does the pain, why is there pain after the fissure surgery, say after 3 months?
Just a second. Can I just do a short screen sharing, which will answer this question in a very, very nice way?
Yeah, sure.
Can I?
Yeah, sure.
Yeah. See, what is a fissure? A fissure is nothing but a crack or a tear. You know? A crack or a tear like this. And that's the reason why the patients have pain, and they actually end up into this cycle. Because of the fissure, because of the tear, they have pain. Because of the pain, the anus goes into being narrow. So it will keep on holding the stools, and the hard stools again will tear. So the patient is trapped in this vicious cycle. So if you take care of the constipation, take care of the pain, and take care of the anal fissure, medicines for fissure are different from medicines for piles. Piles medicine cannot cure an anal fissure. Then 75% of the patients can be treated only with medication. But beyond that, if it is not getting cured, that means the narrowed anal opening, there is no medicine to open it up. That will require a surgery. Here, I offer Botox treatments, which relaxes the muscles without a cut and all. And that's the reason why anal fissure surgery is so very successful. Very less likely that the patient needs to come back for another anal surgery, and that too within a 3 months time period. It really might be a little diagnostic challenge. Some diagnosis must have gone a little up and down.
Right. Thank you very much, Dr. Gore, for this amazing session. I think it's very detailed, very explanatory, and I'm sure there's a fair amount that people have learned today. And those who have missed out on being here live can, of course, see the session on seniorstoday.in when we have it uploaded on Monday. And thank you very much, Doctor. Thank you very much, Dr. Pravin Gore, for this session today. And thank you very much to the team at Wokhart Hospitals to facilitate this. It was an excellent session. And as always, we will be back next Saturday at 5 p.m. for another session of Health Live at Seniors Today. And in case you would like to pre-register for our sessions so that you would like to be informed of all our sessions, please fill in the form, which is there in the link is there in the chat window, and you will be informed about our sessions. Thank you once again, Dr. Gore, for taking so much time out and for an excellent presentation, all of which will be there on the Seniors Today website. Thank you very much. Thank you.
Thank you. Thanks a lot. You are really doing a good job taking care of all the seniors. Really a fantastic job.
Thank you very much.